Hi, the objective of the neonatal examination in this video is learning key aspects of the newborn, the physical exam, and we should focus on the normal versus abnormal physical finding. And first, በመጀመሪያ ሁሌም ቢሆን ኮንግራጁሌሽን ማለት ይኖርብናል። ስማችንን መናገር ለምንድን እንደመጣንና ልጁ ለምንድን እንደምናይ ልንነግራት ይገባል። የመጀመሪያው ነገር ይህ ነው። Then I would like to examine your child. ልጅሽን ኤግዛማይን ላረገው ወይም ደግሞ ለመረምረው ፈልጋለሁ የሚል አይነት ንግግሮችን ልናረግላትና በእናቲቱና በእኛ መካከል የሚኖረውን environment smooth ማድረግ ይኖርብናል። Let us starting from the general observation of the child. ወዲያው የተወለደውን ልጅ immediately ከማየት እንጀምራለን። So ምን ልናይ እንችላለን? The child is asleep or awake. The child is warm or cold. And we should also see the vital sign. የህፃኑ vital sign, pulse rate, temperature, respiratory rate measure ማድረግ እንችላለን. If you see a sign of distress or illness, ህፃኑ ላይ የህመም ምልክቶች ወይም ደግሞ sign of distress ካየን we should refer to the physician, we should notice for the resident, and we should tell about the attendant. ለናቲቱ ወይም ደግሞ ለአቴንዳንት ለፊዚሻን ለሌሎች ሬዚደንቶች ምን ማድረግ ይኖርብናል? ሪፈር ማድረግ ይኖርብናል ማለት ነው። ስለዚህ ከራስ ቅል እስከ እግር ጥፍር የግድ ምንድን ማለት ይኖርብናል? መለካት ይኖርብናል። ከሄድ እንጀምር። The head of first we should measure the head circumference. Measure the head circumference and categorize the head circumference on the head circumference for age percentile. በዚህ percentile ውስጥ categorize እናደርጋለን. So we can screen any neonatal related congenital or neonatal related abnormality that occur in the head circumference. ከhead circumference ጋር የተገናኙ ችግሮች ካሉት መለካት እንችላለን. So we should categorize it under chart ላይ categorize እናደርጋለን. We should appreciate the anterior fontanelle, which is look like the diamond shape, and the posterior fontanelle, which is look like triangular shape that's found at the posterior surface. And if the head ላይ ልናያቸው የሚገቡ ነገሮች አሉ። የሚገቡ suture fontanelles. Suture, for example, we can see the coronal suture, and we should check the lumbonucleus, the anterior fontanelles, the metopic sutures, and the sagittal suture. these sutures የህፃኑ ጭንቅላት በበርዝ ካናል አልፎ እንዲሄድ የሚያረጉ ናቸው። ስለዚህ we should see the skull design often leads to the temporary deformation called molding. So if you get the molding immediately delivery, that is normal physiology. When the skull is pass through the birth canal, በበርዝ ካናል በሚወጣበት ጊዜ molding form አድርጎ ሊሄድ ይችላል። ግን we should grade the moldingን grade እናደርግና grade 3 and above ከሆነ that is complicated types of molding and it needs treatment ያስፈልገዋል. Others, we should see the swelling of the head ላይ የሚገኙ swellingዎች ካሉ check እናደርጋለን. For example, if the swelling does not cross the suture line, the swelling is come due to cephalohematoma. If that cephalohematoma means there is a bleeding below the periosteum. Due to that the bleeding does not cross the suture line. If the bleeding or the swelling does not cross the suture line, this types of swelling is cephalohematoma. So cephalohematoma ነው ብለን መናገር እንችላለን ማለት ነው። If it doesn't cross the suture line cross ካላደረገልን if the swelling is cross the suture line, that is typically the caput succedanum. The caput succedanum is found under the skin, the fascia, and this swelling is come due to the fluid accumulation above the peristem below the skin. ከፐርስቴም በላይ እንዲሁም ከስኪንና ከፋሻው በታች fluid accumulate ሲያደርግ ምን እንለዋለን? caput suicidinum እንለዋለን. And this caput suicidinum it can cross the suture line. And there is also the bleeding that's fine within the head and extensive swelling that cross the suture line. That is a bleeding due to the rupture of imaginary vein. This types of swelling is typically subgaleal hemorrhage. The subgaleal hemorrhage is the most complicated types of bleeding. The child can undergo shock and death. ይህን አይነት bleeding የህፃኑ ሊገለው የሚችል bleeding ነው. Get the cutis aplasia. We can suspect that there is a congenital anomaly in which the scalp has not formed properly. Scalp በበቂ ሁኔታ አለመሰራቱን ያሳየናል. That means skin, fascia and different structure is absent congenitally. That indicate that the cutis aplasia. This finding is not inherently dangerous, but should prepare through the examination for other atypical physical features. ይህን ነገር ካገኘን ሁሌም ቢሆን ሌሎችን ኮንጀንታል አኖማሊዎችን ኤክስፔክት ማድረግ ይኖርብናል. Let us see the face of the neonate. When we see the face of the neonate, we should see the epicanthal fold with the superior parts of the auricles. So the superior part of the auricles and the line that drawn from the lateral epicanthal fold up to the superior parts of auricles, and also we can draw the line that is vertical line እናሰምራለን just parallel and the vertical to the line that draw from the epicanthal fold up to the superior parts of auricle. This is a normal child line. ይሄ ትክክለኛ ህፃን ልጅ 90 ዲግሪ መምጣት ይኖርበታል. But if there is any downward finding of the ear downward ከሄደ ወይም ደግሞ epicanthal fold የተለየ ፖዚሽን ካለ we should suspect chromosomal abnormality, congenital abnormalityዎችን expect ማድረግ ይኖርብናል. So if we get PITS skin tags which is indicate of chromosomal as well as congenital abnormality. PITS skin tag ካየን ሁልጊዜም ኤክስፔክት የምናደርገው ህፃኑ ላይ ኮንጀንታል አኖማሊዎች ወይም ደግሞ ክሮሞሶማል አብኖርማሊቲ ያለበት ብለን ሌሎችን ፋይንዲንጎች ሌሎችን የክሮሞሶማል ወይም ኮንጀንታል አኖማሊ ሳይን ኤንድ ሲምፕተሞችን ሰርች ማድረግ ይኖርብናል ማለት ነው። So the helix formation, the cross formation are the normal formation of the child, and the ear formation can be normal, and the minor version may be associated with a genetic condition, and sometimes the child can have hearing loss, and the neonate can have the kidney anomalies. እነዚህን ምልክቶች እና PITS, skin tag, helix, the cross, they may be normal formations ሊሆኑ ይችላሉ። ነገር ግን እንዲሁም ደግሞ ኮንጀንታል የሆኑ አኖማሊዎችን ወይም ጄኔቲካል ኮንዲሽኖችንም ዲኬል ሊያረጉ ይችላሉ። like kidney anomaly, another anomaly, congenital heart disease anomaly. እነዚህን ነገሮች ልንመለከትበት እንችላለን። So we should observe abnormalities that related to the ear. Look the position of the eye compared to the nose. Palpebral features should horizontally equal in the normal, but sometimes can be up slanting, down slanting. እነዚህ slanting kind positions ሊኖሩ ይችላሉ። So we should see the line that draw the two eyes. በሁለቶቹም አይን መካከል ያለውን የላይኖች መመልከት ይኖርብናል። And in the flashing light, we should see the red eye reflex. red eye reflexን መመልከት ይኖርብናል. If you get one eye asymmetric red eye reflex, we should expect the congenital cataract. It can be retinoblastoma, or sometimes we should see also observe the columboma. The columboma is there is some featuring that is starting from the pupil and goes to the sclera. ከፑፒል ተነስቶ ወደ sclera የሚሄድ line ነው. So we can see this columboma that indicate that there is a congenital anomaly that related to the eye. ከአይን ጋር የሚገናኙ congenital anomaliዎች አሉ ብለን እንድናስብ ያረጉናል. columboma symmetric reflex አገኘን, we should refer the neonate to the ophthalmo or the medical genetic checkup. እነዚህ ቼክአፖች ሪፈር ማድረግ ይኖርብናል. Let us see the nose. The nose of the child should assess the patency of the nares. Neonates are preferers of nasal breathing. So history of the respiratory distress syndrome. History if there is any noising or breathing when the feeding or crying, we should refer the child to the physician, which ENT physician. መጀመሪያ NG tube ወይም ካቴተር ናዛል ካቪቲን ልክና ፓተንሲውን ቼክ ማድረግ ይኖርብናል. If there is any choanal atresia or edema from suctioning at the birth, or any choanal atresia or choanal stenosis, it is very difficult to insert the NG tube. NG tube ማስገባት በጣም ነው ይከብዳል. So the choanal atresia is a part of charge syndrome. The charge syndrome, it can be columboma, heart abnormality, atresia of the choana, retraction of the growth and development, a genitourinary abnormality, and ear abnormalities. So the choanal atresia or stenosis, if you get the choanal atresia or choanal stenosis, we should refer to ear, nose and throat specialist and the medical genetics. በእነዚህ ባለሙያዎች ቻይልዱን ኒዮኔቱን ሪፈር ማድረግ ይኖርብናል. We should also check the mouth. We should examine the neonate of the mouth, and we should observe the hard palate and up to soft palate. And we can get also cleft hard palate or cleft lip. Cleft hard palate ወይም ደግሞ cleft lipን ልናገኝ እንችላለን. ስለዚህ mouth examination is very important. If we get cleft palate or lip, we should refer the child to ENT specialist. Cleft palate is commonly an isolated congenital anomaly, but can also be occur associated with other medical condition. ከተለያዩ medical conditions ጋር ልናገኘው እንችላለን. But most of the time the cleft palate is associated with other medical condition, but commonly it's isolatedly ለብቻው የሚፈጠር congenital anomaly ነው. And we should see also the tongue. We should see the movements of the tongue. And sometimes we can get the ankyloglossia or tongue tie. This tongue tie cannot push the tongue and pass lower gums. So this ankyloglossia or tongue tie can be a minor variant and is not a sign of a genetic condition, but could impair an infant ability to breastfeed. የኢንፋንቱን ability of breastfeeding affect የሚያደርግ ነው. ስለዚህ አንኪሎግሎሺያ ወይም ደግሞ ታንግ ታይ ቼክ ማድረግ ይኖርብናል ለማለት ነው. Because they may be indicate for breastfeeding problem. የብሬስትፊዲንግ problem አንደኛው ክፍል ሊሆን ስለሚችል. So the brief overall examination of the mouth, the nose, the eye, should be considered. እነዚህ ነገሮች ኮንሲደር ማድረግ ይኖርብናል። Let us say about the neck of the neonate. The neck of the neonate, we can get the neck waving, and there is also redundant skin on the posterior surface of the neck. Those things can indicate that there is a Turner syndrome. If you get the redundant skin, there is Neonatal syndrome. So neck waving, which is indicate the Turner syndrome, and Neonatal syndrome is mainly indicated by redundant skin. So next examination is very important to consider if there is a genetic or congenital anomaly. Genetic or congenital anomaly when chromosomal abnormality ያለ የለም የሚለው። Others, we should check about the clavicle, the fracture or not. የክላቪክል መኖርና ለመኖር ወይም ፍራክቸር መሆንና ለመሆንን ቼክ ማድረግ ይኖርብናል። If you get the fracture of the clavicle, we should refer the child to the surgeon. This is come due to dystocia. Let us see the chest. Normally, the chest should be flat, but if there is a concave or not, if we get the concave, the cause of a concavity of the chest is pectus excavatum, and if the chest is convex, which is pectus carnitum, more common in some connective tissue and cardiac disorders. Example, the Marfan syndrome can cause chest deformity or chest abnormality. Chest ላይ deformity እንዲኖር ከሚያረጉ ነገሮች ውስጥ ማርፋን ሲንድሮም ወይም ደግሞ ፔክተስ ኤክስካቫተም ፔክተስ ካርኒተም የሚባሉ ነገሮች እንዲፈጠሩ ከሚያረጉ ኮንጀንታል አኖማሊዎች ውስጥ አንዱ ማርፋን ሲንድሮም ነው። ነገር ግን ህፃናት በብዛት ፍላት chest wall ይኖራቸዋል። ስለዚህ chest examination is very important. An isolated pectus abnormality is considered a minor variant and is not a cause for a genetic referral. ማለት ግን ሁሉም chest ዲፎርሚቲዎች የጄኔቲክ አብኖርማሊቲ ናቸው ማለት አይደለም። ግን ሁልጊዜም ቢሆን ምን ማድረግ ይኖርብናል? we should consider the genetic referral of chest abnormality like Marfan syndrome. ልክ እንደ ማርፋን ሲንድሮም ኮንሲደር ማድረግ ይኖርብናል ማለት ነው። and we should check about the heart soundን ቼክ ማድረግ ይኖርብናል። የአራቱም የheart sound hearing ወይም የheart sound ብናዳምጥባቸው ቦታዎች like aortic area, pulmonary area, tricuspid area and apical or mitral valve area. So the normal newborn heart is between 120 up to 160 beats per minute. This is a normal heartbeats of the newborn. So the pattern, if we get the pattern ductus arteriosus, we can hear the continuous machinery like murmur. በጣም continuous የሆነ machinery types of murmur ማግኘት እንችላለን if there is a patent ductus arteriosus PD ካለ። Other heart murmur, particularly those that do not improve with day, should further evaluated. If you get heart murmur, we should evaluate further investigation, that is what are the cause of the heart murmur. heart murmur ካገኘን ሁልጊዜም ቢሆን የዚህ heart murmur ምክንያት ምንድነው የሚለውን አንደርላይን ኮዞችን ቼክ ማድረግ ይኖርብናል። So the heart murmur, the cause of heart murmur is a different entity, but we should pre and post ductal oxygen saturation. First, we should see the oxygen saturation, and for extreme blood pressure, we should see also EKG. We should hear in stethoscope. It is normal for infant to take short pause in the breathing አብዛኛውን ጊዜ ቸስት ላይ በምናይበት ጊዜ ህፃናት በራሳቸው ጊዜ ብሪዚንጋቸውን ፖዝ ሊያረጉ ይችላሉ። ስለዚህ ለተወሰነ ሰከንድ ብሪዚንግ ፖዝ ቢያረጉ that is not abnormal. That is normal for infant to take short pause in the breathing ላይ short pause የማረግ ይኖራቸዋል. And sometimes they can cause irregularity. So the periodic breathing is a normal condition of the neonate. Periodic breathing is a normal condition of the neonate. So we should check the breathing status of the child. We should examine the anterior chest and we should also examine the posterior chest. The newborn respiratory rate is 30 up to 60 breaths per minute. This is a normal breathing status of the newborn. Let us see the abdomen. In abdominal examination of the newborn, we should check if there is any. We should check the umbilical area. We should check the cord. If there is any swelling in the cord, it can be paraumbilical hernia or it can be umbilical hernia. The swelling, it can be bleeding of the cord arteries, cord veins, mainly cord blood vessels. So we should check the cord abnormality. And we should push እናረጋል በእጃችን ወደ ታች ስንገፋው ወደ ውስጥ ስምጥቃል that is hernia. Hernia that feel firm or is stuck in place may be incarcerated. በእጃችን አልገፋን ያለ hernia ከሆነ ግን it can be incarcerated types of hernia. Incarcerated የሆነ hernia ነው. So we should refer this types of condition for surgical specialist for further evaluation. In abdominal examination of neonate, we should check if there is any organomegaly. We should measure the total liver span. We should measure also the splenomegaly. Splenomegaly ካለ spleen examination is mandatory. While rare, some infants may have intra-abdominal neoplasm such as neuroblastoma or the Wilms tumors can be occur in the abdominal examination. ስለዚህ እነዚህን ብላስቶማ ወይም ቲዩመሮች in abdominal examination appreciate ማድረግ እንችላለን. The child can have neuroblastoma or Wilms tumor. Let us see the groin area. We should check the pulse of the femoral artery bilaterally. So we should check the femoral artery compared to the radial artery. If there is any aortic coarctation, there is a discrepancy between the radial artery from the femoral arteries. So aortic coarctations is one of we can diagnose aortic coarctation by checking the femoral artery. This can be further investigated by measuring pre and post ductal oxygen saturation and four extremity blood streams. So femoral artery examination is mandatory. We should check also the female genitalia. The labia, the clitoris may appear engorged as a result of maternal hormone. This is normal. Some newborn even experiences small amounts of vaginal bleeding. Another common finding is a vaginal skin tag on the posterior forecheek. On the posterior forecheek we can get a skin tag. In the male, we should check above the testicle. That is descending or ascending. If there is any swelling, we should also see the swelling of the testicle. If you get swelling, we should see that there is a hydrocele. Hydrocele is a fluid collection around the testis which will spontaneously resolve. This is a resolving types of swelling. So examine the penis for any abnormality related to the curvature. That is the foreskin fully covers the glands. So we should examine also the penis. If you get the whole foreskin often indicates of the hypospadias, the ventral displacement of urethral meatus. It tells that the hypospadia. So we check the skin folding, the opening, the urethral opening, in order to see the hypospadias. In all infants, in both male and female, we should assess the patency of the anus by using one hand to hold the leg and the other to gently spread apart and the gluteal cleft, and we can insert the little finger into the anal canals. If we can assess the patency of the anal canal. It has its extremity. The extremity of the neonate, the child can have polydactyl type B. The neonate can have also, this is a normal finding, polydactyl B is a normal finding, and this is a normal hand of the neonate, but sometimes there is a brachydactyl. That is, brachydactyl means short types of digit, and arcanodactyl, which is long types of digit. So we should check the length of the digit and the number of the digit, and we can also check the palmar crease. If you get the horizontal or transverse palmar crease, more common infants with a neurological condition like Down syndrome. If a child who has Down syndrome, it is a genetical problem and it has a transverse types of palmar crease. The minor variation in the hand morphology should not provide referral to the genetics. The minor variant in hand morphology should not provide referral to the genetics if it is not the major anomaly. The major anomaly of the hand or the feet. However, such missing or extra digits should provide further investigations. We should see the back of the neonate. የህፃኑን ጀርባ መመልከት ይኖርብናል. We can get the blue-green macules. It's common. Feed over time. So if we can get also erythema of toxicum, the pustulon and the erythema of the base, and appears at 24 out of 48 hours of life and disappear. The scarl depot, check if you can clearly visualize the base of the indentation. So sacral dimple can develop due to tethering of the cord, spinal bifida occulta. Other finding concerning for spinal cord abnormality, the conceptuous patches of hair on the lower back and the symmetry of gluteal cleft tells there is a neurological abnormality. Let us examine the neurologic examination of the neonate. First, we start from the conscious level of the child. If the child is awake or asleep, irritable or calm. So irritable or calm consider እናደርጋለን. Can be hypertonic or hypotonic. Does the head come up with body or not? ለዚህ ከሄዱ ጋር ከመጣ ሃይፐርቶኒክ ነው። ሄዱ ጋር የማይመጣ ከሆነ ደግሞ ሃይፖቶኒክ ነው ማለት ነው። Does the head ligam just እነዚህን ቶኒክ ስታቱስም ቼክ ማድረግ ነው። The motor function assessed by observation, does she move all her extremity or well? Is her face symmetric or not? Should we check? We should also examine the sensation, and we should see the primitive reflex of the child. The primitive reflex of the child. Note, if they are symmetric or asymmetric, may indicate the neurological or orthopedic conditions. The symmetric no የሚለውንም ደግሞ ቼክ እናደርጋለን. The first primitive reflex is a Moro reflex. Hold the infant and pull forward until a few centimeters above the basin. The Then drop her head gently into your other hands. Hand should open, upper extremity should extend, then retract. This is a positive sign. The palmar grasp reflex. We should check the palmar grasp reflex. We should check the rooting reflex.